Juan, thank you very much for being here today. You are representing Colombian Healthcare Properties. Can you tell us more about your company, please?
Perfect. So first of all, thank you very much, Gustavo, for inviting us to do this interview. And thank you for actually preparing this Ibero-American, Latin American session. I think it is great. And this is going to be the first of many. I am the manager, the general manager, the leader of a private equity fund called Colombian Healthcare Properties, who focuses primarily on healthcare real estate. So what we do at the end of the day is that we partner up with the big, good, proven healthcare operators, and we help them either to monetize some of their real estate assets to invest those resources in their operation and improve their operation, or we help them in their growth strategies by providing them build-to-suits. And we can even develop some hospitals for them, so they do not have to preoccupy about the infrastructure. So they focus on what they know, that is operation.
Perfect. And healthcare is a very tricky sector. I hear that if you know how to do it, you do very well, but can be very tricky because it depends a lot about your clients' characteristics. It also depends on a lot of different specific things that are very specific for the sector. It's not something that anyone can just go and do business there. What would you say in terms of the main aspects of the business that one should be aware of?
I think you're right on the spot about healthcare. This is not something that you should kind of invest lightly. I think the counterparty risk is the most important piece here. You have to understand really well who do you do business with. You cannot do business with like everybody. You just want to do business with the operators, the healthcare operators that have already been proven, that they know what they do, that they have been in the market for 10, 20, 15 years, and they have really strong financials. Because otherwise you will become kind of a white knight, and this is not what we want to do. We want to be kind of a stable partner who can provide these resources for them to be better, but we are not there to save any operator. We are not there to create kind of a new groups of operators. We are there just to help the ones that are already being proven.
Perfect. I would imagine that COVID-19 brought a lot of challenges, but also some opportunities for the business. What are the main lessons learned from COVID-19, and what trends have emerged from this situation?
I think we can split the question into pieces. First one is with regards to us, like real estate, healthcare, and the second, I think it's about healthcare in general. When you talk about healthcare in general, COVID was really tough for like hospitals and the whole overall kind of healthcare system. But at the end, what ended up doing is repressing a lot of the services that were not provided. So when you see the numbers of services that are provided today in comparison to pre-pandemic years, we are now above like 15 to 20% more services than before. So if we before had a shortage between the supply of healthcare services and the demand from the population was big before, that shortage is just increasing by time. So at the end, there were challenges, but nowadays there are, like, in terms of, it's difficult to say it, but in terms of, if you see this as a business, the demand is growing and growing and growing. It will continue to be growing. And also it's growing, unfortunately, it's growing on diseases that are more expensive, like cancer, for example. Cancer is, unfortunately by the word, cancer is booming. And cancer, it's a good business. It's a good business for the operator. It's a good business for the real estate provider because they can pay even better. So that's kind of an overall. For us, our learning, it was shocking and it was positive because during COVID, like many other partners, let's say, or many other real estate investors were struggling with commercial, with offices, with different theses. They were renegotiating contracts and doing a lot of renegotiations with their tenants. We did none whatsoever. None renegotiations.
Can you imagine?
It wasn't asked to us. None of our tenants were asked us to renegotiate any piece of the leases that we have with them. So instead of we're like watching our peers renegotiation everything, like, you know, terms, costs, everything. We did none whatsoever.
That's interesting.
So that was shocking and positive for us.
Yeah, it's a very critical sector especially in countries where population is aging.
Yeah.
And there are a lot of challenges on that way, and it's definitely growing. Now, we are here sitting in Madrid, where we have almost 200 investors, developers, lenders from Mexico, from Brazil, from Peru, Colombia, Chile, and a lot of players from Spain and Portugal as well.
Yeah.
Each one have a different agenda. Some want to raise capital, some want to deploy capital in the region, but the only truth is there are a lot of synergies and the capital flow is there, and what we can sense that. What's your play here?
I think we have, in Colombian Healthcare Properties, we have a dual play. We are here in Madrid to meet people and to understand opportunities in Spain, because we still have capital to deploy. So we would like to understand the real estate healthcare industry in Spain,
Okay.
And see if there are opportunities to create a, let's say, regional portfolio. Because at the end, we consider Spain to be part of the region in Ibero and Latin America. But also, we want to be a big fund at the end of the day. And to do so, we need resources.
Of course.
So it would be really good if we can also partner and meet some resources to go to Latin America to do a strategy that I think it's really relevant, because I think it's really profitable, but also it goes beyond that. You know, in terms of ESG, for example, that it's very well talked, and everybody talks about ESG and the impact that you can create and how ESG can be introduced into real estate. This is the perfect strategy, because the impact that you can create to the community is huge. When you develop a hospital, you create a huge impact on the municipality, on the city that you do. So I think we are leaders in ESG in this strategy on healthcare.
Well, thank you very much.
Gustavo, thank you.